Memory loss is not an inevitable consequence of aging. Recent studies show that we can keep our brains healthy much longer than previously thought, as long as we know how to take proper care of them. But why can seemingly harmless medications cause such severe damage? And how can we protect our brains while treating other health conditions? These are crucial questions we will answer throughout this video. It's important to emphasize that we are not here to demonize modern medicine. Many of these medications are essential for treating serious conditions and improving the quality of life for millions of people. However, it is vital that we are aware of the potential risks and know how to minimize them. Let's begin with two medications that seem harmless but can have devastating effects in the long run: omeprazole and anticholinergics. First, let's talk about omeprazole, one of the most popular medications for treating heartburn, reflux, and gastric ulcers. It belongs to the class of proton pump inhibitors, PPIs. Seems harmless, right? Not so fast. Recent studies have revealed a concerning connection between prolonged use of omeprazole and an increased risk of dementia. A study involving around 6,000 people showed that 10% of participants who took omeprazole for more than 3 years experienced memory loss. Another study revealed that 33% of patients who used the medication for over 4.5 years reported cognitive disturbances. The issue with anticholinergics, for example, is that they block the action of acetylcholine, a neurotransmitter crucial for memory and learning. Prolonged use of these drugs is associated with a significant increase in dementia risk. Studies show that continuous use of anticholinergics increases the risk of developing dementia by up to 54%. Common examples include first-generation antihistamines, such as diphenhydramine, certain antidepressants, and medications for urinary incontinence. The indiscriminate use of these drugs, especially among the elderly, is concerning due to their negative impact on cognitive health. That's why it's important to talk to a doctor before making any changes to the use of these medications. Let's move on to corticosteroids and benzodiazepines. Corticosteroids are widely used to treat a variety of conditions, such as asthma, allergies, and autoimmune diseases. However, prolonged use of corticosteroids, especially when administered orally, is associated with several serious adverse effects, including mental and cognitive health deterioration. Studies show that corticosteroids can cause structural changes in the brain, leading to issues like disorientation, confusion, and even depression. On the other hand, benzodiazepines, known for their calming effects, are often prescribed for anxiety and insomnia. However, prolonged use of these medications can double the risk of developing Alzheimer's, possibly due to permanent brain damage. Now let's talk about amphetamines, widely used in the treatment of ADHD and first-generation antihistamines. Amphetamines, like Adderall, can improve concentration in the short term, but prolonged use is associated with serious side effects, including memory loss. First-generation antihistamines, such as chlorpheniramine, are effective in relieving allergy symptoms, but they also have anticholinergic effects, which can lead to significant cognitive problems, such as an increased risk of dementia. Therefore, it is crucial to consider safer alternatives, such as second-generation antihistamines. Finally, we arrive at tricyclic antidepressants and statins. Tricyclic antidepressants, like amitriptyline, have strong anticholinergic properties, meaning they can block acetylcholine, leading to memory issues. Prolonged use of these medications is associated with an accelerated decline in cognitive function. Meanwhile, statins, widely prescribed to lower cholesterol levels, have sparked controversy due to potential side effects on cognitive function. Some studies suggest that statins may interfere with cholesterol production in the brain, which is essential for synapse formation and cognitive function. Therefore, it is crucial that patients and doctors discuss the potential side effects of these medications and closely monitor any cognitive symptoms that may arise. Remember, your brain is your most precious asset. Take care of it with wisdom and attention. Before we wrap up, if you enjoyed this content, don't forget to hit the like button and subscribe to the channel. This helps us continue bringing relevant information to you. Also, activate notifications so you don't miss any of our upcoming videos. Thank you for watching and see you in the next one.